My name is Robert Faulds, and this is my visual and verbal presentation on exercise and back pain. I'd like to start off by saying that 80% of the population will experience back pain at one point or another in their lifetime. An issue being seen a lot today is with people seeking over-the-counter medication as a treatment for their back pain opposed to proper treatment. This can be the difference between acute and chronic back pains. So acute pain is described when a pain lasts less than 3 months. Close to 70% of acute back pain can be related to the muscles, such as spasms or tear or sprain on the ligaments and muscles. Chronic pain is described when pain lasts longer than 3 months. 20% of people who suffer acute pain will go on to suffer chronic pain. Examples of chronic pain can range from skeletal disease to muscles. An example of chronic pain can be scoliosis or even abnormal spines in the curves. Or trauma such as a compression on a vertebrae, shifted vertebrae. Moving on. There's a couple burdens that come with back pain. Someone suffering from back pain may experience a couple different issues such as loss in quality of life. What do I mean by quality of life? Well, quality of life is happiness, comfort, health, socializing, just general well-being of a person. Back pain can really diminish that for a person, and this can result to medication being a quick fix to regain a quality in life again. With back pain comes movement restrictions. Obviously, the mobility of a person is necessary. An example of a movement impairment would be not being able to bend backwards or bend forwards, sideways, or even just rotating. Loss in income can come, as back pain is one of the leading causes of work disability. In fact, back pain comes in second place right after the common cold for days off work. Chronic pain or acute pains can lead to prolonged periods off work, which lead to loss in income. What's interesting is you can link the three of these: loss in quality of life, movement restrictions, and loss in income. The three of these can be directly related to each other. An example of this is pain causing movement restrictions can lead to days off work, which can lead to a loss in quality of life, a loss of income, can't go out, can't afford rent, so on. Moving on from that, so why exercise? Well, exercise reduces the reoccurrence of back pain. It helps restore the function and mobility to a generalized area, as well as other areas. It's a longer term solution compared to medication, and of course, general exercise is good for the person. So when dealing with back pain, what kind of exercise is important to deal with? You want an exercise routine that balances strength, stability, and mobility. An example of an exercise program that's really good for this is yoga. Yoga combines stability, strength, and mobility all in static, dynamic stretches and movements. So, mobility. Everyone needs mobility to move their joints, muscles, and limbs through their full range of motion. It's important to work multiple areas such as the lumbar and thoracic spine, because when someone's suffering from a back injury, it's very common that another area of the body is going to be affected by this. So when working, Like a lot of exercises and stretches will affect more than one area. An example of this is you can see there's the cobra, the skeleton doing the cobra. This is going to be affecting the curve in the lumbar spine as well as the thoracic spine and the cervical spine. So that's an exercise that works all three spines. Although there is an abundance of thoracic and lumbar exercises that you can put together and it works the same area, there is very limited that you can do for the cervical spine. You can basically just do flexion, extension, and that's about it. So strength and stability. These go hand in hand together. Without strength and stability, you wouldn't be able to walk, you wouldn't be able to kick a ball, you wouldn't be able to do a lot of everyday exercises that you do today. A lot of exercises for stability incorporate core strengthening exercises as well. Some examples of exercises that incorporate both core strengthening and stability include prone bridging, so this skeleton pose on the elbows, or that on the side on one arm as well. And Superman's, when you lie down on your stomach and you flex your legs and your arms backwards. Back pain and posture. Lower back pain over a long period of time can affect other parts of the kinetic chain, and so can back pain in general. Typically, pain in one area will affect more areas than one. So, over time, this will affect the curves in the back, your primary and secondary curves. An example of this could be someone suffering from lower back pain may hunch over for relief, and this will cause a roll in the shoulders. And this will strain the muscles, and that will lead to further complications with the back. There's a lot of contributing factors to back pain, but some of the most common ones are tight hips, tight glutes, tight hamstrings, these generally tight core muscles, and of course, just bad posture can affect your back. So, basic movements. So this is a test that everyone can do at home or at the office that you can tell if you have tight core muscles. And this is, you place 2 fingers on your front hip bones, you move them an inch inwards and an inch downwards. When you do a muscle, you contract your core very softly. If you feel a doming under your fingers, your muscles are compensating somewhere else in your body. Another basic movement is being able to bend over and touch your toes. That's a movement that the human body should be able to perform without an issue. If a person is having issues with this, it might be a good idea to seek a stretching program, an exercise program that can accommodate for this issue, as it will help address it and maybe even prevent future back pain. But so if you're unable to touch your toes, it can be due to lack in flexibility, or if you just feel stiff or sharp pains in your back when bending over. In conclusion, back pain affects millions of people each year, and it's important to maintain an active lifestyle, but remember that if one part of the body is injured, another part of the body is going to be compensating for that. This means when dealing with pain through exercise, you're most likely not going to be dealing with one generalized area. There's going to be more areas than one. An example of this could be a large variety of back pain can be directly related to the hips. Like when you have severe back pain, you can feel it in your hips, in your legs, and in some cases even your feet. But what's important to keep in mind when dealing with exercise and back pain is that exercise should not be treated as a primary medical treatment for people suffering from severe spinal diseases or bone diseases of any sort, and they should continue to seek medical advice.